Welcome to Marney Reid Presents Connect to Develop, where we provide insight from healthcare leaders on the hottest topics and trends.
Welcome to the second episode in this two-part series featuring Dr. Genghis Niver, double board certified orthopedic hand surgery specialist at Summit Health in Park, New Jersey, his incredible physician assistant, Meagan Lugo, and joining us today, along with Dana Jacoby, is Renee Paveglio, Regional Director of Orthopedics and Podiatry for Summit Health. Today's episode talks about the patient experience and lowering the cost of care through an optimized office-based procedure practice for hand surgery specialists. Welcome, Dr. Niver, Meagan, Renee, and Dana.
Thank you very much for having me today, and I really look forward to talking about how we're able to lower the cost of care and also the patient experience from having in-office procedures and a streamlined office approach.
Hello, thank you for having me back. I look forward to sharing more insight on how we work together to make the patient experience the best that we possibly can.
Hi, everyone. Thank you for having me. I'm looking forward to joining the podcast today.
Thanks so much for having me, Marnie. It's great to talk to you. I'm really looking forward to this conversation.
I'd love to start with Renee. So on the first episode, Building a Highly Efficient Patient-Centric Clinic for Hand Specialists, we talked high level about resources and infrastructure needed to build out a very efficient office-based procedure practice. This could not have been possible without the partnership and support of the business side of the practice. So from your standpoint, understanding that you personally are an RN first and foremost, can you walk us through the rationale for why you allocated resources to enable this practice model?
Yes. So when Dr. Niver first approached me about doing in-office procedures, I think there was two sides of it that I needed to take into account. One, the patient experience, and then two, being the administrative cost side of creating something new like this. So I think just speaking about the patient experience, being a nurse myself, doing a procedure in the OR requires a lot more preparation on the patient side as well as on the surgeon side in the surgery center. So in my opinion, this is a much quicker way for the patient to get the same results. It's a lot easier to schedule in the office versus having to book a surgery into allotted block time in a surgery center. There are certain restrictions that you don't have to take. Some of cases that are done in the surgery center are local and you don't have to fast, but for all the procedures that we do in the office, you don't have to be NPO. You don't need to take significant time off of work because it's an in and out quick procedure. So I think in general, when Dr. Niver and I first talked about it, my first thought was, well, this is going to be a much easier patient experience. And then in addition to that, it's more cost effective for the patient, which I would get into when I talk more about the administrative side. So looking at how I justified this from a business perspective, it's cost saving in general for the patient because the insurance company doesn't have to pay facility fees, but also just from our own internal perspective, we're not looking at the additional staffing that's required to run an OR. We don't have to have the same kind of extensive setup and instruments that are required in an OR. There's minimal implants that are used. So there's big savings from that perspective. But something that I think is really important to note too, though, for the patient is that just because you're not going to be in an OR, you're not getting any less care. Like you're still getting the same physician, the same PA that are just going to take as good of care of you in the office. It's just you don't have to go through all the nuances of like getting ready to go to a surgery center.
So how is this reflected? If I'm out there and I'm, business person and I'm trying to, justify this, not just on the patient experience, but also the cost savings, did you look at any of the books afterwards just to see what kind of savings?
I think from the business side of it, something important that I should note is that Dr. Niver taking these procedures and doing them in the office does allow for more availability in our surgery center, which is great because Dr. Niver can do several of these cases back to back in the office, which opens up a significant amount of time in the ASC for maybe bigger cases or cases that can't be done locally in an office space, mini OR kind of setting. So we did go back and look at that. And I think that's been a big gain for our surgery center. As far as the patient experience goes, definitely it's been word of mouth that we find that patients they think it's so much easier to just go into the office versus having to book in the surgery center.
What were some of the key growing pains that you'd like for your colleagues and other business managers around the country to know about?
So I think that's a great point. I mean, we did have to set up our own procedure room where we can do these types of procedures effectively. So we spent a lot of time working with Dr. Niver to make sure that we had all the instruments that he needed. He created like his own customized kit, same kind of things that he would want in the OR for these surgeries. We made sure that we were able to provide on an office level, in addition to a specialized chair that we can use in the office to do these procedures as well. So right now, looking at 2024, we have been able to appropriately complete trigger finger releases and dequare veins releases. But our goal for 2025 is to move into doing more carpal tunnel releases, mass excisions, some nail bed repairs, but that does require a little bit more additional equipment like a cautery unit, a smoke evacuation unit, and then there actually is an additional procedure chair that we're going to be getting that just lets Dr. Niver manipulate the patient's position better. So those are all things that we will be acquiring to be able to do even more surgeries, but there is some cost and setup associated with it. Still, there's a savings though, even with the addition of the supplies that we have to obtain.
Dr. Niver, in the first part of this series, you talked about how you set up your week. For our listeners tuning in maybe for the first time in this series, his ambulatory surgery center, also referred to as ASC, if you hear us just say the acronym later on, is on a different floor in the medical building where his clinic is located. And he has a dedicated room in his office for smaller procedures. And coming in January 2025, for those listening prior to that date, we'll actually be opening up a larger procedure room with more equipment to do more procedures. So the schedule is set up. So Monday and Tuesday are just clinic. Thursday is scheduled for just clinic with the occasional add-on procedures if the need arises. And on Wednesdays, you're either doing office-based procedures or at the ASC, and on Friday at the ASC. So can you walk us through the patient care pathway? And let's start with new patients coming to see you in clinic. And then after you explain that flow, we'll talk about patients coming back into your office for the procedure that you've already aligned on that they need based on their first visit.
So the patient experience has actually changed a significant amount over the past few years. We've implemented an orthopedic call center, which allows for a dedicated specialist to sort out patients by location and specialty and what their complaint is. And so that's been something that's streamlined the appropriateness of referrals to us. But in addition to that, our electronic medical record, which is Athena, allows patients to schedule on their own using the portal, which allows them to bypass wait times, human interaction, and just get scheduled in. So essentially what happens is when they're on the schedule, they get checked in by a front desk patient services representative or PSR, and that shows them on the medical electronic record as having been checked in. The medical assistant then calls their name in the waiting room, asks them about their complaint, and has really been trained well in sorting out who needs an X-ray and who doesn't. And the goal for me in that situation is to make sure that they get an X-ray before seeing me so that we don't have to send them back for X-ray using an exam room and that's sitting idle. Essentially, so once they are deemed whether or not they need an X-ray and which body part requires the X-ray, they're sent to X-ray and then brought into the room where they will have filled out an intake form by that time and had their vitals checked by the medical assistant. Afterwards, it's flagged for me that they're ready. And I go in with my scribe, or on some occasions, I have Meagan go in with a scribe to just get the basic intake of the patient as to what their complaint is, what their exam shows. And then that allows me to go in and speak to the patient about their exam, speak to them about their complaint and their assessment, as well to establish a plan with the patient as to what to do next. If a patient requires surgery or any sort of in-office procedure, other than anything like an injection, they then meet with my surgical scheduler who counsels them on my availability, tells them about the instructions, whether or not they need to fast, if it's a general anesthetic, and what day that they're scheduling for. And so everything is pretty much streamlined. When the patient exam is also concluded, if they require an injection, that'll be done at that visit, in addition to any DME or supplies that are provided to the patient, such as wrist splints or thumb splints for their condition. And so my office more or less then is instructed to ask the patient, to not ask the patient as to whether or not they need a follow-up, but if they've been directed from me that they need a follow-up, schedule a follow-up appointment for the patient as well.
That sounds like quite the flow. Did it take a while to get to that? I mean, were there some trial and errors, and how much have you refined
that patient experience as you've started the office-based procedures?
There's definitely been a lot of trial and error. First and foremost, my medical assistant who was with me for 5 years had a very, very keen awareness as to who requires an X-ray, in addition to knowing the actual complaint of the patient. But the difficulty then there occurred with trying to schedule the patient and seeing who's appropriate for the office and who's appropriate for the surgery center for some of the minor procedures as well, like a trigger finger. And so I've started to ask questions that allow me to screen a patient as to their appropriateness if it can be done in this office where a patient doesn't get lightheaded from any prior procedure or from seeing any blood, or in addition to seeing that the patient is able to supinate their arm because of the table that I have, which is really a chair with two big arm boards. And so if a patient can't supinate their forearm, for me to see the underside of their hand, that's a procedure that I can't do in the office. So these are all learning pains that I've had over the past few years. And still on occasion, we have a patient every few months become near syncopal from the actual procedure. And so my goal is to avoid that in the office and make sure that they're able to lay supine on the operating room table in the ASC.
Makes sense. And then as you get to the point where you're about to launch this new office and add on, I think you were saying it's about 4 to 5 new procedures to be able to do in the office. What do you think the biggest changes for you and your staff will be?
The biggest changes for the staff will now be seeing if we can get a table where a patient can lay supine so that I'm able to really do almost all procedures that are local anesthetic, not requiring X-ray in the operative suite that we're going to start building in the office. Supply wise, our goal is to get cautery there, which we don't currently have. And so I try to perform procedures that require minimal cautery and have minimal bleeding involved. And so that's something that we're also going to start to figure out once the cautery starts to be established in the procedure room that we have.
That makes sense. So, Meagan, we all know that no well-run physician's office can create and maintain a smooth workflow without a wonderful support staff. So, as someone who has helped Dr. Niver refine and perfect the patient care pathway, can you share some lessons learned from your viewpoint and sharing with your colleagues around the country whose physicians may be embarking on this journey, the best practices that you've identified and implemented during the years?
Yes, I'd be happy to speak on that and kind of share with everyone the things that I've learned over the years and what works best for us and our team. We touched upon in the first podcast kind of the flow of our days and the different roles and importance that everybody has. So one of the biggest things I would say is the function of our team. I think, Marnie, in the first podcast, you described us as a well-oiled machine. And going off of that, when you have a well-oiled machine, each part is important and everybody who contributes to the machine functioning has to know their importance and their value. And one of the things I would say Dr. Niver does the best is to make everybody know and feel important, whether it's our medical assistant, our scribe, the front desk staff, surgical scheduler. He understands and makes us appreciate our value. And so whether it's someone checking out at the desk or me going in and seeing a patient, we're just as important as him. And knowing our value and knowing the value that we give to that patient experience and to his practice is one of the biggest things that makes us function well. Because if somebody doesn't understand, why them checking out a patient in a timely fashion or with a smile on their face, it's just as important as him giving a patient an injection. If they don't understand that matters, then those are the things that start to kind of fall away and give the patient less of a positive experience.
Meagan, I know in the first episode, we really talked about the engagement and the teamwork that you and the medical assistant and the nurses, especially on the day of the procedure, have, and even the scribe. But for those listeners tuning in for the first time, can you kind of touch on, the kind of synergy and the flow that you've created to make sure that Dr. Niver's life just runs smoothly, as well as the patient experience on those days?
Yes, I'd be happy to. So the patient experience on those days starts from even before they come in, right? So our surgical scheduler calls them usually the day before to let them know exactly what time they should come in and check in so that everything runs smoothly from that point forward. So the patient comes in, I've prepared the consents the day ahead of time. Our medical assistant sees that patient checked in at the front, and then medical assistant begins the process of bringing them in for their procedure. The medical assistant then brings them back into the room. She makes sure she has the consent, will come to me on occasion and confirm, the procedure, the side, what we're doing, if there's any concerns that I have about the patient. Another thing that we do ahead of time is make sure from the patients as best as we can that they're not prone to getting lightheaded or dizzy, because those are kind of things that can make an office procedure not ideal. So we try to know all of that ahead of time so that we're best prepared for how to handle the patient and make it a good experience for them. So once the medical assistant has this done, Dr. Niver comes in, consents the patient for the procedure. And that's when I'm talking to the nurse, making sure, hey, we have everything in the room ready to go. If it's a mass excision, that we have a finger tourniquet, which is something that prevents. Once the patient is in the room with the medical assistant and Dr. Niver has done the consent, I'm working with the nurse to make sure we have everything for the procedure, because not all procedures are the same. So if it's a day that we're doing a mass excision, I'm making sure that we have something that we need from upstairs to control any excess bleeding and things like that, which is all things that make the process more efficient once we're in the room ready to go, that we have everything and that we don't then have to send our nurse or medical assistant running around for additional supplies.
Dana, you help practices and health systems and even individual providers all over the country to really come in and, to what we alluded to in the first podcast with operational excellence, figure out where the gaps are, where they could strengthen and where they could cut some fat, or maybe even, just kind of, put everything together a little bit more impactfully, especially if they've just, gone through a big aggregation, or they've split off, or maybe they've even, kind of joined on with a different partner, whether that's health system, private equity. So in your vast experience, are most hand surgery specialists maximizing the surgeon's time and utilizing their clinical support staff in an efficient manner?
You had me except for most. There are some great examples, Marnie, of people doing that well. I think that, if you look back traditionally at hand surgeons, they've been really great about being kind of the F-16 pilot, right? Where they were doing a lot of things themselves, not being the Delta Airlines pilot or the American Airlines pilot, where they were working in a team of people and trying to maximize care. A lot of times I always joke with our doctors in the hand space that they should GoPro their office, right? You think about putting a GoPro on your head and kind of, going through the office and seeing the inefficiencies. And it's mind blowing when you do that, how you really should have every care team member playing at the height of their licensure. We had a situation the other day where the hand surgeon was scheduled correctly, but the footprint in their office for the staff to get to one room to the other. And then ironically, and this is going to sound so simplistic, but the staff wasn't setting up the trays and the procedure rooms exactly the same way. So the surgeon would come in, and you don't think seconds count, but in surgery and in hand surgeons world, seconds do count. And so even having your trays systemized, your staff systemized, everything systematically set up on the schedule makes all the difference in the world. And we just find that most doctors, forget about surgeons for a minute, most doctors just weren't trained in efficiencies versus inefficiencies. And so it's just that habitual way it's always been done. And we had another doctor that really said, hey, can you come in and spend a day with us and look at the inefficiencies of the practice? And I literally sat with a legal pad and followed patients through the office, one by one, but at check-in, and little things made a big difference. The TV was in the wrong place in the waiting room. I mean, simple things. The clipboards that they were using to walk the patient back weren't appropriately placed. We lost not just minutes, but by the time the end of the day happened, we had lost over an hour and 25 minutes that could have been added back into the schedule just because patient care wasn't set up and efficiently set up the right way. Everything shouldn't rely on the doctor's efficiency. In other words, are you a slow surgeon or a fast surgeon? That's important, but what's more important is the infrastructure and staff around you set up for everybody to play at the height of their licensure, and the office and the overall flow is set up for patient care and patient efficiencies to naturally take place.
I have to assume that, in a world where patient satisfaction scores, and patients doing everything from the food being the biggest reason why they'll give a hospital poor patient satisfaction. I have to assume even things as such as I had to crane my neck to see the TV, or there was no water for me, losing 1.5 hours to the backlog. In a world where patient satisfaction scores can impact everything from obviously the complaints to the, the reviews that they leave, to even sometimes reimbursement for providers, shaving off even just 5-10 minutes, let alone 90 minutes, has to be huge for an office, right?
Huge. And setting appropriate expectations, Marnie. I mean, one patient shows up late or one staff member, takes off in the middle of the day to go do something. And it should be a well-oiled machine, and people should be cross-trained enough that you shouldn't have those big gaps in care. But yeah, it's really, I think the biggest thing from a patient sat standpoint that we've seen is if everyone in the office is attuned to that, and you can capture, okay, this was off at this part of the visit, or this was off, and you can address it at the point of care, then you're not playing that Herculean lift of, I'm sorry, we're 90 minutes behind and the doctor didn't meet your expectation, and now you're going to leave and tell 15 of your friends in the world of viral social media, maybe 100,000 of your friends, how unhappy you are. It's really being able to focus on that at each step of the patient visit. And like I said, it sounds goofy, but even if you say GoPro your office to your staff, you don't have to go buy the device. They get it, and so it's everybody owning each part of that visit and working like a well-oiled machine to make sure that patient feels like they are checking into the best medical practice in the country.
So on top of obviously patient satisfaction being tantamount and creating an environment where, we hear from a lot of clinicians that if you don't create a very systematic environment, that's where errors could happen, not always do, but could. Yeah. I know that the people hiring you not only want to see patient sat go up and just see the flow and everything improve, but from a business standpoint, when we're looking at margin, bottom lines, P&L, because, at the end of the day, someone's paying for, people to come in and help optimize. What could that mean for a practice from a business standpoint, even just to maximize those 90 minutes?
Yeah, well, I mean, sadly, Marnie, when you look at the fee schedule year over year, you're taking anywhere from 3 to 5% of a cut every single year. So without ancillaries, a lot of times the office procedures are just going down, right? Every year, CMS is cutting. So just from a staying efficient, just to keep your head above water standpoint, right? Everything else should be gravy after that. It makes a big difference. I think the bigger thing for our doctors is we hear a lot about physician burnout. We hear a lot about doctors who are, throwing in the towel, that are tired and are basically retiring to be consultants. A lot of it comes from the lack of science and systems behind our ability to manage care. And I think, if you think about every day you wake up, if you did something completely different every single day and tried to manage a team of people where everybody was functioning in a different role or at a different level of licensure, it feels like mutiny on the bounty. Versus if you show up to a well-oiled machine, the patients are in throughput, you don't even have to really worry about the profit and loss statement because it's going to show up at the end of the year, and you're not spending extraneous time, money, materials just to get everything back to normalcy. And so, it's interesting to me. It shouldn't all hinge on the physicians to fix this, but they have to be the leaders in training their care teams on why this is important. And then number two, every care team member should really be focused on, again, playing at the height of their licensure and making sure their respective role stays as efficient as possible to get the patient through the system at the right time, at the right place for the right procedure.
That makes sense. It's interesting. You always think of, athletic trainers and everything from athletes to people, rehabbing from post-operative surgeries and stuff. It's almost like these care teams need, the personal trainer for optimization and efficiency.
No, I mean, you joke, Marnie. I think that's a great business for someone to start to do the calisthenics of efficiency. It is mind-blowing. Even some of the top systems in the country, when you walk the walls as a patient, it's really fascinating to see simple things making massive differences. And I think that's the real urge, I guess, for our doctors on this podcast, is to really think, about their practices and go back through your practice as a patient one day just for kicks and giggles and try to go in as a naive or hire somebody to do it. There are patient shoppers that will go through the practice mystery shop on the phone. And it's somewhat frightening when you see the results of some of those surveys to see what actually goes on behind the scenes.
So Dr. Niver, in our prep conversations leading into this series, you really talked about the excitement that you have, expanding from doing 2 procedures into getting a bigger procedure room, requiring, a little bit more equipment. Can you talk to me from a provider standpoint? I know we discussed everything from burnout to being, much more engaged and feeling like you truly can serve to a better degree your patient population around you. Can you share a little bit more with us, just purely from not only a surgeon, but just a father, a husband, a person that has maybe friends and hobbies, what building something like this and then continuing to add on more procedures is doing for your life overall?
Well, absolutely. The thing that I would say is that number one, when I'm doing these procedures in the office, I'm in complete control of my schedule. I can set up how many patients I want to see per hour. I'm able to have a little bit of downtime in between some of these procedures while Meagan is closing and we're transitioning the patient out from the procedure room to the exam room, allowing me to catch up on clerical things in the office or documentation, anything like that. In addition to that, when I am able to do these in-office procedures on Wednesdays, most of the time, if it's only that, I do get out a few hours early, allowing me to have more free time outside of work. That's completely different than the surgical center that we used to, be at on Wednesdays and Fridays, where sometimes I would run till the late afternoon and not being able to have that control of my schedule. The thing that I'd also say is that it's a big feeling of accomplishment for me that I've actually set up a footprint in the hand surgery world around here, that I'm able to do these in-office procedures with many benefits to the patients, and that patients are seeking me out for that experience. So it's something that makes me feel valued and that I'm contributing something to patients here to optimize their experience. Essentially, this also enables me to preventing burnout for me outside of work, so that, instead of spending hours in a surgery center or even a main hospital with inefficient turnover or a lot of delays in between the day, that, my day ends pretty late. With the in-office procedures, I have so much control of the efficiency that it allows me to get home earlier. I have a newborn at home that I always can't wait to see. And it allows me to be with my wife where I can spend time with her. And these types of things that, allow for the efficiency to be present. I'm still doing the same volume. I'm still doing the same care for my patient, but it allows me to have that ability to spend time outside of work. The other thing that I actually would also mention regarding building up a team is that the team members really understand what's involved in the postoperative care for the patient and even for the patient expectations, so that a lot of my time isn't spent directly speaking to a patient about how long do they have to have their dressing on for, how long should they avoid getting their hand wet for, and will they need therapy. Most of the people in my office that answer the phone for that, either of the nurses or my PA, Meagan, are able to answer that question efficiently, allowing me to, really be able to step up for complex questions or decision making and speaking to a patient directly about anything significantly complex.
Well, we truly appreciate what you and your colleagues around the country do for patients out there. I know at some point I may need your assistance, so I'll just be flying up to New Jersey. Don't mind me, but I'll get to meet you and Meagan in person. So Meagan, rounding this out as an integral part of the practice, you had to have, experienced everything from the gripes and even the gratitude of the patients coming in. Can you share some anecdotes from patients who are coming to see you on the post-op visits, who have been able to come into the office for a procedure versus having to go to an ASC?
Yes, I'd be happy to share that. So I see, as we've mentioned before, all of the post-ops for their first 90 days. So I really get to hear from them, how their recovery is going, how happy they are with their procedure, the experience, the outcome, et cetera. So I would say the biggest thing is patients come in, their first post-op, they're a little nervous. They have to get their stitches out. They're not totally sure what to expect. I make them feel comfortable in that process. And one thing that they're saying is that they can't believe how quickly the procedure day was itself, that even though Dr. Niver kind of explained to them, it's a simple procedure, it's in and out, you can eat, you can drive, your day and your life is not really going to be impacted as a result of this procedure, because we've made it so streamlined that until they go through it, they don't understand how easy and convenient and painless for the most part that it was for them. Some of these patients actually are seeking out Dr. Niver. They're telling their friends, they're spreading word of mouth around their towns and communities. And then people are coming to us, hey, so-and-so had this procedure done by you. They said it was one of the best experiences. So I'm here now to address this issue because this is something we want done in this manner. Believe it or not, some people come in, they may have seen another opinion already. It may be an older, more old school type of person that's still putting people to sleep, believe it or not, for these procedures under general anesthesia, increasing risks of anesthesia. So for some people, just being awake is a big deal. And now being able to do it where they just walk into an office and don't have that fear of, hey, I have to go to an operating room, I have to change my clothes. This is a big deal. It kind of puts them in the mindset, yeah, this isn't that big of a deal. I'm going to go into an office. This is going to be a quick 1, 2, 3 kind of thing. So I think that makes a huge difference.
Well, thank you for sharing your thoughts, your ideas on this. This has been an incredible series. And for me personally, it's been amazing just learning more about hand specialists, their support teams, and ways that you are continuing to evolve healthcare to benefit the patients, as well as the overall dynamic that we're seeing where we're really trying to reduce the overall cost of care. So if you want to learn more about Dr. Niver and his practice, or Dana Jacoby and Vector Medical Group, please check out their bios in the show notes.
Thank you so much for having me.
Thank you for having me.
Thank you, everyone, for your time today.
I really appreciate, Marney, you having me on the podcast. I think this conversation is so front and center for what's happening around the country right now, and I'm looking forward to continued conversations.
Thanks for listening to Connect to Develop. You can find more interviews and Marney's Minutes on my YouTube channel at Marney Reid Presents.